Okay. My listeners know I'm very happy when I can go live. And right now, there's no glitch. We are here. I'm rubbing shoulders with Dr. Daniel Elnatan and Alec Kassin, who could be a doctor in a minute. He's so smart and so cute. Anyway, I'm Dr. Tovah Goldfine. I tend to forget to say my name, but I get very excited when we go live here every week. This has been weekly for 6 years. And as I say each week, I am not slowing down. If I can keep rubbing shoulders with people like Danny and Alec, I'm not slowing down. We'll just keep going because there's so much to say. And we have so much information and so much inspiration and education to give to our listeners, to our community, to help people. I mean, honestly, we know that you are the placebo and you are the medicine. We're just here. We're called geshers. In Hebrew, that means we're bridges. We're just messengers here just to give you like what I call your power back. Take it back.
Definitely.
Or like in Dorothy in Wizard of Oz, you never lost it. You're always home. Yeah. So I'm going to sit back. I'm going to be a little quiet tonight. Dr. Danny Elnatan, I love to say your name, is a chiropractor in Colorado, a mind-body chiropractor. We met before a few weeks ago, and I invited you back. Alec Kassin is a injured athletic comeback coach. Wait, I wrote this down. I love what you're doing, Alec, here. And so I asked Alec and Dr. Danny to join me because movement is so important. Fearless movement is really our goal. But even if you have fear, it's okay. We all have fear. But, there was a book years ago I heard about called Feel the Fear and Do It Anyway. And I believe that we can take our fear, have coffee with it, take it to the gym, go to sleep with it, have a relationship with it, and we can move freely and calmly. So, Alec and Danny, I want you to start this conversation and talk a little bit about maybe your stories, how you met fear, and then maybe how we can help the listeners with their sensations and their fear.
Definitely. I'll let you go ahead, Alec,
Sure.
if you want to.
Yeah. Sounds good. Well, Tova, Danny, it's so cool to be with you both, and to all the listeners out there, hello to you all as well. It's always special to be back on the round table. This is my second time, I think, and
I think it might be your third,
or
but
third.
anyway,
I
it's
can't
okay.
even. It all flies by so quickly. Fear. I think it's core to this work. The way I think about helping people is really what we're doing is doing two things. It's being authentic and expressing our authenticity and embracing fear. And for me, that fear came about when I was 18 years old, rewinding the clock, over almost a decade and a half now. And I was a semi-pro cyclist, and basically a fancy way of saying I was racing against professionals, but wasn't being paid, kind of like a wannabe semi-pro cyclist. And cycling was my life. It was my identity. It was something that, talk about movement. Like I moved on a bike, and like that was my raison d'être, as the French would say, my reason for being. And all of a sudden, I was out on a training ride. It was 10 days before I was going to do my first like big kind of professional race that Lance Armstrong had won 2 years prior. And 10 days before that, I was just out on my bike riding, and I felt this lightning bolt of pain in my lower back. And it was so strange. And I couldn't sit down on my bike seat. My pain was so bad. And I went to a chiropractor. It was the first practitioner that I saw. And he said, don't worry, in 2 weeks, you're going to be back on top. And I trusted him. I was like, okay, 2 weeks, it's going to be fine. But 2 weeks turned into 2 months, and eventually turned into 2 years of chronic debilitating back pain that not just derailed my cycling career, but also took me out of college, left me partially bedridden, depressed, eating my meals standing up, had suicidal thoughts, and was terrified that I was going to be in pain for the rest of my life. And thankfully, after trying all different physical treatments, I discovered mind-body connection. John Sarno, did my own work with a TMS therapist, and met a lot of different fears that, and that's the reason that I'm in this work today, is essentially help people meet their fears, be authentic, and make a pain-free comeback.
Amazing. Yeah, I think, first of all, I think that fear is a very natural and basic emotion for human beings, and I think probably any animal, because it's what keeps us safe and alive. It's there to protect us. But what happens, for us humans, and particularly now, in the more modernized world, fear became such a big, powerful sensation from so many, aspects and reasons, that it's kind of really, we're losing control over it in a way, and it's getting a hold of our lives again in a lot of aspects. My personal story is I dealt with mainly migraines from a very, very young age. Um, I remember myself, as a kid, always having migraines. There wasn't a time that I didn't have it. Um, and I, grew up in a house where my mom had it, my brothers had it. So it's kind of, you watch everyone around you too. So it's always there. It's normal, right? And that's why I didn't deal with it, at the time. Doctors always said, like, maybe there are triggers, food, stuff like that. But, you try it. Sometimes it works, sometimes it doesn't. But as I was growing up, I noticed a pattern. When the migraines arrive, how long do they stay, and what's going on in my life around it. And another thing also, with growing up, I also was, separately from the migraines, but I was a very depressed kid, emotionally depressed. I was always, shut down, closed in my own world. I had a very bad social anxiety. But again, I thought that I was the problem all the time, and I didn't talk about it. And I just, if I would go to school, and this kind of connects to the fear part, I would be terrified, about, being around other people. But, this is the world, so I had to do it. And I couldn't admit, what I'm feeling inside. So I just kind of, probably seemed some weird at times. Teachers used to kind of, always call me out in classroom, like intentionally, like make me talk. And I like, no, leave me alone. But all this, kind of growing up in this situation, you really kind of grow up in insecurity. And then all the symptoms just, get really worse and worse over time. I used to like really not like, the physical classes, because that's when, everybody watches you, how you run, how you do stuff. And I didn't feel comfortable there. So I always got knee pain. And every time I had to run, I got shin splints and stuff like that. And it's like, you start to always think like, why is it happening to me? What's going on? What am I doing different from all the rest of the people around me, that I'm getting hit, with all this stuff? But I was always interested in the aspect of Eastern medicine. Started off more by following Bruce Lee. Kind of got me into martial arts. But then when I followed his work, he has a lot of really good insight and philosophy about just mind stuff. And that really got me at a young age starting to think about how I perceive the world may be affecting what's going on with me, or maybe I might be causing my own suffering in a way. But so I had that idea there, but I never dug enough into it, and I didn't have enough resources to go into. So I couldn't really find the answer. So it kept staying there in the background. As I got into adulthood and got into relationships, it's kind of you learn to put on a face for a certain moment, and then when you go and you have a moment to be alone, everything kind of comes back. Definitely, again, every time that I had like something in a new job or something new coming up, I would get so stressed about it that those migraines would really, hit me hard. All the aches and pains and stuff like that. So I started to make the connection. Again, I'm getting stressed. I'm going to get more. I'm feeling it more. And then what happens? You're aware of it, but you're not really dealing with it. And life took me through different experiences, and I worked in a lot of different fields. I finally decided to get back to school, and that was after my dad got sick with cancer. And his story kind of threw me into looking into chiropractic, because I saw that for him, he wasn't really getting answers that are helping him too much. Like his diagnosis from the medical field was, you're going to die. And that's it. So now we're just gonna maybe prolong it, but you're gonna suffer and die. And that's how we lived. So so again, and this goes back, like you want to find a solution for other people, but this led me to my own solution. So I got into chiropractic because it was a very holistic field. You get to work with people and patients, but also in a way that is more personal, and you're not relying on any medications or other procedures. It's basically your touch and a relationship with the person in front of you. So that's what really got the ball rolling. Unfortunately, my dad was very sick. I was in the US, and he was resilient to any ideas outside of what he was offered back in Israel. So after a few months, he passed away. But I still, kept, searching for more and more answers. And as I was seeing, my own patients, I noticed that everyone has a similar pattern, no matter if they come for back pain or leg pain or headaches or neck pain. There was always something lingering underneath. There was another layer underneath that I could see that people don't let go of. So maybe they might get, a temporary relief through my treatment, but I could see, it's really not resolving that back pain that keeps coming back, or those migraine that people have for a long time, or the tinnitus we talked about, before we got on air. So I started, to think about it, what's going on. And then you start, talking with people more and more and more, and you see that people are really holding on to emotions, or maybe if not, it doesn't even have to be something, from the past. It could be just the way that react to events that are happening now are causing all that. So that's when I really started to get into more of the mind-body aspect and introduce that to people and, bring that up. And that's when, I could see there was a shift in the way people reacted. And that's when I had a shift from doing the traditional chiropractic work of, pop and crack, to really using touch for a few reasons. One is to just, first of all, promote safety. When you put your hands on someone and they're laying on your table, like we talked about Tovah, they feel safe. So it takes down all those walls that people have around them. Another thing is, it's very helpful, a diagnostic tool. Is there really something structurally, going wrong in the body or not? But the techniques that I use are much more gentle. Again, I'll use my touch in different, like, soft tissue work or stuff like that, or people call it craniosacral, whatever. There's a lot of names. I just learn on my own. I incorporate everything together. So this day I blend in a lot of that experience that I'm still learning, from people. So it's the touch. If I need to do more of just, if I know that the person in front of me is really open and ready for understanding the mind-body concept, we'll dive into it, and I'll see amazing results. If it takes longer, I'll do more, body work. And also, talking again about placebo. I think a lot of time it's not, there's nothing wrong with using the body work as a placebo. If someone feels it's helping them, then
Mm-hmm.
fine. I don't want
Mm-hmm.
to confuse them with other ideas that they're not ready to hear.
Mm,
But it's through that long-term relationship, you kind of slowly put in the sow the seeds in, and my hope is eventually to just get people more aware of this concept, because I really think that that's the core of a lot of things that we're dealing with, and we can help us gain
Yeah.
control of what's going on.
Danny,
Great. I feel like I started
No,
off and it went on and on, so I'll let
no,
you
good.
jump
No,
in.
there's more to say. I just want to add one thing, and I was going to ask Alec, you know, stretching and movement is somatic. Okay. So, like if we go back to Sarno's, basic concepts, I mean, he's like, get back to your exercise, don't miss a beat, go ahead and, take a few steps. And how many people have we met that, you know, walk a little bit and then do a little jog, but like they like I said, they take the pain and they do it anyway. And this is a Sarno concept. And I just, what I do with people is when their body mind, I say, look, this adjustment, this treatment, I want it to work, and it work better if you understand that the cause is in your brain. I
yeah,
just say it's going to be a better ending. So go ahead, Alec.
I love that you mentioned that, and to what you were saying, Danny, about the treatment like placebos, and one of my credos for this work, and one of the things that really lights me up is not just helping somebody resolve their symptoms, their back pain, their migraines, etc. It's understanding that it's the changes that they've made, and it's their own power that has led to the changes. I think
Yeah.
so often we have this idea, especially we're bombarded with it in the medical world, that you need a pill, a procedure, a practitioner in order to fix you.
Right.
And I think what is so radical and amazing about this work is to say, actually, you are not broken on a physical level and also on the spiritual, mental, emotional level, and that you have the power to do this. You have the power to change. You have the power to change your body, not in some weird, airy fairy way, but in a real, grounded, scientifically validated way. And it takes this power that has been taken away from us through nocebos, through um, the wheel of sickness and dis-ease that we see in the medical world, and it gives it back to us. And I think that, to me, more so than resolving symptoms, that's really what lights me up, is when somebody recognizes, wow, the changes that I've made in my life have led to this symptom resolution. Like, how cool is that?
Yeah, I agree, and I think, and maybe you can also identify with this too. I know Tova probably will. A lot of the times, people, after a successful, change, will reach back and say, "Wow, you did magic! You fixed me!
Yeah,
And I really feel uncomfortable, and I tell them,
me too.
listen, even though I worked with you, I didn't create that. I helped you get there. I guided you, but you did it on your own. You figured it out on your own. So so
Mhm.
while
Beautiful,
it feels great, when
beautiful.
people tell you you did magic, but no, we didn't don't do anything. We just help you, and it's really important to get that message across, because again, you don't want people to rely on you or a drug or anything else, and thinking that that's what's helping them.
Yeah, yeah.
You want them to understand that they are on this path, and sometimes you need a good guide, at the beginning at least. But once you understand, the concept, then you're on your own.
Mm,
And that's maybe, part of it. It's also building, confidence, with people. So they know they can, be on their own, and face life and fears, and tackle everything in a good and healthy way.
mm,
Look,
well said.
to all the coaches, we're all practitioners. We're coaches. We're helping people. This is what we do in our careers. And I like to say to the listeners that it's actually a strength to reach out to a coach. It's a strength to reach out and say, I need guidance. And especially because this is not, this kind of pain that we see is it's counterintuitive. And I'm quoting Alan Gordon. This is counterintuitive neuroplastic pain, mind body symptoms, medically unexplained symptoms, physiopsychological symptoms are not pain. In other words, pain means something is wrong, but not this kind of pain. So we have to educate people. I had to be educated. You had to be educated. You had to be educated. We're here to educate our clients and our students and our community because it's not typical, because the brain sees pain as danger, but this is not that kind of pain. Let's chat a little bit about this. Is a whole different ballgame. And chronic autoimmune symptoms are not because something is wrong with your kidneys or your liver or your skin. It's a learned pathway. And so let's chat about that so people can be empowered that their symptoms are not here to hurt them. Let's talk a little bit about that.
Yeah. Danny, do you want to go first or should I?
Yeah, sure. I think, yeah, definitely pain. And again, any lingering symptoms people may have, it's a message. It's your body and mind's way of getting your attention. If something is going on, whether it's an injury or something internal in your body or something more emotional or events in your life that you're not facing at all or in the right way, then your body will try to get your attention. Your mind will try to get your attention, and if you don't notice it or listen, it will start screaming at you till you finally realize that you need to make a change. Now, most of the time at that point, when your body is screaming at you, you're in a lot of pain and you don't realize that that is the reason. So you just fall into that hole of, why am I in pain? And then start, searching for all kinds of methods to deal with it. It brings us to like another idea that for me, in my practice, I see people, for various reasons of musculoskeletal issues. So they're not necessarily coming to me all the time after like not finding solutions for chronic symptoms. And when I see them for the first time, I can already see that they're at the beginning of developing chronic pain. Even if they don't have it, I can see they're gonna get there. So that makes my job more interesting, because I will introduce it to them, very, very early on. I'll tell them, listen, this is actually a good thing that's happening to you. And I think instead of, fearing this pain, you should actually say thank you, because your body is now talking to you and trying to grab your attention. So let's see what's going on. And then I'll go, through a history and, what might have triggered it. When did it happen in the past? And there's always very interesting stories that come up. I can give you, one story on a woman I saw with back pain, and it flared up. And after a few days, it didn't go away. And she heard about me, and she came to see me. And she couldn't move, do a lot. So I sat her down. I didn't even touch her. We started talking, and I asked her, how long has it been going on? And she's, of course, it's only like a week. Like I'm usually healthy, nothing's wrong, I'm happy. Okay, and we continued the conversation, and then she kind of throws something. Well, you know what? I remember when I was, in my 20s, I was, in Germany, and something happened, and I really got this bad back pain back then, and it didn't go away for a long time. And I think she was going through a divorce or something. And then, it went away, but it kept coming back every few years. And then she, while she was talking about it, she figured out that every time she got, very stressed, or her cup got, too full, she couldn't handle something too much, her body started to break down. And as soon as she understood it while she was talking to me. She felt this kind of relief, and that was amazing. Like I didn't even do anything. I just brought it up, and she started talking. And then we kept going through it. And after this one visit, she felt amazing. After a week of not doing any activity, she went back to work. She went back to the gym. It doesn't affect her anymore. So that's the biggest thing about it.
What's the relationship? This was a big topic. We had a big conference here in Israel. Some of the docs from America, Dan Ratner spoke on a video, Dr. Schubiner, Charlie spoke on the Zoom, and the big conversation was about the relationship between the practitioner and the patient and the client, and how powerful. And you just explained that. You just said how powerful that is. That how safe she felt.
Yeah.
That she was able to get to that place. And that's placebo plus. So go ahead, Alex. So share a little bit about the topic we were just talking about.
Yeah,
Okay,
there's two things that come to mind. The first is there's a study. I learned about this through a webinar that SERPA and Georgie Oldfield put together. We're doing fantastic work in the UK.
Yeah.
This group called Liberation Found, and they were collecting healing stories of people from around the world, different cultures, different experiences, different languages. They wanted to understand what were the commonalities to healing experiences. Yeah. And the biggest factor that they came across was what somebody learned about themselves. That was the biggest factor. And the ways that people got there, some people it was through acceptance, some people it was through empowerment, some people was through somebody, not through somebody else, but in conjunction with somebody else, like a practitioner, other people on their own. And I think, Danny, your story with that patient is so powerful because it illustrates one of the many ways that we can get to this transformation for people. Sometimes it's physical touch and hands-on and creating safety. Other times it's safety through words. Other times it's, journaling exercises or somatic tracking, whatever it might be. And I find it endlessly fascinating, the different ways that people can approach this work in. And Tovah, the original question brought up my situation of movement and diagnoses. I think it's a really interesting space that I see a lot of patients or clients get stuck in of, okay, I'm pretty sure this is TMS. I'm pretty sure it's mind body, but what if there is something that's missing? What if there is a torn tendon or that herniated disc really is causing my pain?
Doctor made a mistake. The doctor
made a mistake. I need another test. And I was interested. So when I was 18, I got an MRI after about 4 months of back pain. And I was diagnosed with a ruptured spinal disc, L4, L5, and a herniated L5, S1. The doctor said, pretty sure this is what's causing your pain. And you should heal from it. You might heal from it. We're not exactly sure. You might have to manage it for the rest of your life. And to tell an 18-year-old that, I'm like, oh my gosh, this is crazy. This is awful. Well, I've been back pain free for over a decade. And when I was living in the UK last year, I was curious, do I still have that ruptured spinal disc on my MRI? And so
maybe before the show is over, I want to ask you what you were thinking on that bike when you got that sharp pain, but that's another question.
Oh, that's, yeah.
So go ahead.
We can get into that. So we fast forward, it's 2024, I'm in the UK and I decide to get this MRI. And I get the report, and it's so interesting because I had a little bit of back pain for like the first time in years as I'm in the MRI machine. Talk about, memories and the brain trying to protect. Like the last time I was in one of these machines, I was in immense pain. It was bringing back a little bit of it. But the radiologist, I got the report back, and they compared the two reports from 2011 and 2024. And the radiologist wrote that the L4, L5, L5S1, basically unchanged. So I've been doing 500-mile bike trips and back bends and all-day hikes and all of these different things without even thinking about my back. and yet I still have the same underlying pathology. It has not changed at all. So for
Very
anybody out
important.
there,
Say that again. Say that again.
yeah. So my pathology, my ruptured spinal disc, has been with me from at least 2011 through up until present day. And yet in 2011, I was in immense crippling back pain, and I haven't had any back pain in over a decade. It was never causing my pain. It doesn't affect my mobility today. It's pretty incredible that what you see on an MRI or an X-ray is not always the cause of your physical pain.
Herniated disc happen acutely, maybe 2, maybe 3 months. Doctor did maybe 3 months you have symptoms, and then it's not coming from the disc. This is science, and I don't know why doctors say your problem is the disc, because they know it's not. We're not here to bash doctors. They just say it because that's what they say, but the disc is not causing the problem after an acute disc. Maybe an acute flare-up of inflammation, but it's not coming from the disc itself. We're not going to talk about disc pathology, but anyway, thank you for bringing that up. So I also want to address, I lost a little bit of my screen for some reason. It's just a little challenge from God, but we're okay. Do you see Agnes's question? I don't know if I can bring it up. Do you see it?
I see her statement.
Here. I moved it. Yeah. Okay. So here it is. Agnes is also a coach in Canada. Do you know Agnes, Alec?
Yeah, I've seen some of her work.
Great. But I know I think she had scoliosis and a whole bunch of chiropractic stuff. Okay, so good. My MRI looks the same as it did when I was in debilitating pain. So relatable. Great, absolutely. And scoliosis does not cause chronic pain. Spinal stenosis does not cause chronic pain. In fact, we have all met so many people with every kind of label, every kind of disease, and people can heal. It's possible and probable. So I'm not going to let you, lean into a diagnosis or a label and believe that you can't heal, because I believe, this is my opinion, and I always preface that it's not about the symptom, but it's about your relationship with your body, your nervous system, and the symptom. I say that like on the record. I don't know how you guys feel about like certain things you won't really, and I just recently had this discussion with Dr. Hanscom, who I study with. I meet people with chronic fatigue, which is really debilitating. Whoa, like long COVID, chronic fatigue. And I spoke to him and I said, Doc, I'm not so advanced with all that. He said, Tovah, you treat it the same way. It's the same nervous system. It's the same threat physiology. It's the same fight, flight, and fear, fear and freeze. And I understand that maybe there's some different techniques, somatic, maybe some vagal toning, maybe some, different things I'm learning. But, when we have chronic pain or autoimmune symptoms, it's coming from a dysregulated nervous system. And I think all of our treatments can pretty much, help. Let's talk about that a little bit, because, there's so many, long COVID's going to be around for a long time. It's going to come to our offices, and I want us to be able to help those people. What do you think, guys?
I agree. Yeah, it all falls back to the same idea and concept of first of all feeling safe and not amplifying too much. What's going on in your body. You have to, in a way, take a new lens. Maybe step outside, look at yourself from the outside, and kind of assess what's going on, and just quiet down the noise. If I can go back to the talking about scoliosis, I have a story about that too, with a young 20-year-old girl, and she used to come in, and that was back when I was working in a different office, so I wasn't really doing my own work. I was under another chiropractor. Was early on in my career, but she came in. She was very crippled, and her spine was already fused together. but again, you have a person like this. What you can see is that obviously, they can't move a lot, but they're really broken, inside, because all of these years they didn't get any good solution. All that she heard was, you got to live with it, and this is the way it is. And in her case, they said, even surgery might not help you, so we don't want to go there. So she really, walked around with that, sensation of hopelessness. And again, the way I approach it, obviously, with chiropractic adjustments, you can't, realign the spine in that way. But what I just focused on is, again, building that relationship, that connection. I wanted to make her feel safe in her own body, and I wanted her to forget all that noise she had in her head, that this is the way she is, and she's stuck with it. And after a few months of treatments, and again, just making her more and more comfortable with herself, and the environment, and moving a little bit, adding movement, of course, is another important thing. She gained so much confidence in herself that she started to walk taller. So obviously, I know she wasn't fully like a normal spine, but you could see that at least she's feeling good, and it's helping her move in a better way, and getting more active. What I'm trying to get at is that even in those cases where the body is physically, let's say, fused together, you can still have a say, and you can still affect it through how you think about it. And even if you don't get to a fully erect spine, at least you're feeling good with yourself, and you can move around, and not feel so down all the time and depressed by it. So that's really important for people with stuff like scoliosis or any other things, or herniated disc. The biggest thing that I always cringe at is that when people will have a long-term backache due to herniated discs, and then they'll get either spinal fusions, or because the facets seem to be irritated, they'll get all these fusions that they don't need, surgeries, and that just causes more and more trouble later on, because obviously it doesn't take care of the issue. And second thing is, whatever they're dealing or not dealing with is still going to be there, and it's gonna get worse, because now you had surgery and it didn't help you, so now you're going to feel even
Yeah.
more bad. So always open your mind, try to get more opinions. I think the best tip is really listen to yourself, because people, we know our own, the best. So if some doctor or some friend or someone tells you something that you feel like isn't the whole story, go and look for more different answers than what you're looking for.
Good point. Good point. And I'm sure, Alec, you bumped into some compassionate doctors along the way, as opposed to just, I'm sure that you attracted doctors who were like, hey, Alec, let's figure this out. What's plan B?
Yeah, absolutely. And just one thing that's coming up is, for the people who are listening to this, like, the fact that you are on a Facebook page, on the TMS Roundtable, getting this information is sign that you have what it takes in order to get better. Because there are so many people who have these conditions who have internalized these messages from the medical system or from loved ones about, I'm broken, I can't do this, I just have to live with it. And I think anybody who seeks out something like this conversation, it's a sign that you actually are open-minded, that you can heal, and maybe you've been stuck in this world for a little bit and haven't found the way out yet. And I relate to that as well. And in my original back pain story, like, one of the biggest things that I came across was I would just get just depressed and frustrated after failed treatment after failed treatment after failed treatment. And it was my dad actually who he came in after one of those visits and he said, we're just going to keep going until we find the right thing. And that I think was so, so important. It's just you keep going, and it can be just as easy to get stuck in healing, trying to fix something wrong with your body, as it is in the mind-body world sometimes. Do I need to do somatic tracking, or do I need to do journaling, or I'm getting all these messages, and what do I actually need to do? It just perpetuates this idea that something is wrong, that there's something to fix. Yeah. And Danny, what I love about what you just said is essentially the idea, it comes back to your own intuition, listening to yourself. And that's what we are not taught often, especially when it comes to our care. And so as a practitioner, I always approach it from the perspective of this person is the expert in their life, and they need to listen to their own intuition.
Wow. So important. And again, this show could just be, we could just change the name right now. Like, how do we empower you, to be your own doctor? And how do we give you the power back? Because that's the solution. I mean, we don't say this very often, but isn't it true that your body created this chronicity and your body can create the healing? Like the same body that created the symptom can go back and create the solutions. The same, they say that your body has the solution before the problem. So your body was well, and now it created this to wake you up, to ask for attention. It needs movement. It needs love. It needs compassion. It needs patience. So, on that note, I would love to ask you, Alec, first of all, was something going on in your life at 18 that created like such a sharp pain that rearranged your soul, let alone brought you to a great karmic, place in your life? But like, what was going on at 18? Because if you had that herniated disc, why then? Why in that seat?
Right. I love that term, rearrange your soul. That's an apt way to put it. So leading up to that point, so some context, and Danny, I love that you shared this in your story. Like when I was in high school, middle school, elementary school, like I was small. I was like the smallest boy in my grade. I was one of the youngest in my grade, and felt like I always had this chip on my shoulder. I played baseball, but I'd kind of struggle through and try to prove myself. And I finally found cycling, where my size was actually, it would help me go up hills faster than somebody with a baseball player body. And I was in a place at the time where it was the summer of my freshman year of college, where I told my parents, I'm like, hey, I'm going to school, getting my degree, and my priorities are cycling first and then everything else. So I was like, my identity was completely wrapped up in being a cyclist. And it was, as I mentioned, 10 days before this big race that I was going to do, I had just been promoted into a new category where I was going to be racing against professionals for the first time. And despite the fact that I was in the best shape of my life, I could go out on 4 or 5, 6 hour training rides, I should be good. I knew that I was going to get destroyed. I knew that it was going to be very humbling to do these, 125-mile races and maybe not finish them because I was just too slow. And for somebody who had a really fragile sense of self-esteem, fragile sense of who he was, his identity, his own self-worth, that was a huge threat.
Do you think you had some doubt, like about your ability to, is that what you're saying?
I had some doubt about my own ability to compete and to prove to myself that I was enough, to prove to my coach, who I didn't have a great relationship with at the time, to prove to him that I was enough, to prove to my teammates that I was enough, to prove to this chip on my shoulder, to myself that I was enough. And it wasn't a coincidence that the back pain came seemingly out of nowhere physiologically. But looking back, it makes all the sense in the world why it arose when it did, to essentially protect me from these emotional hurts and these wounds.
Wow, very interesting. So when you got into the mind-body world, you understood exactly what was going on, like what the trigger was.
Eventually.
So come to today's world where you mentioned that you still have occasional symptom. Is it because of this similar trigger or similar pattern? Because we're not here to change who we are. We're here to accept it what I call evolve.
Mm-hmm.
And part of it is this, like, unconditional love for who we are and our characteristics are. In Hebrew, we call it our midot, our personality. And so here you are, Alec, successful coach, but still Alec.
Yeah. And
So,
I think one of the things that came across in my last recovery, there was all of this empowerment of feeling like I came back to my power, and I was kind of changing my symptoms. And I haven't had the only reoccurrence of back pain that I've had in 12, 13 years was the day before my ex-girlfriend of 5 years and I split up. The day before, crippling back pain, just that, which we can get into at a different time, but talk about emotional wounds, right? But what I have been navigating recently has been tinnitus, headaches, like jaw tightness and tension, and it started when that relationship around the time when that relationship ended, and also coincided with moving back to California from moving abroad, starting like really going all in and creating my own business and the stress that comes with the financial obligations, etc. And as much as my last recovery was about me stepping into my power and changing my symptoms, it feels like this recovery now, what I'm called to do is let the symptoms change me. That I've been
wow.
resisting certain things in my life, resisting thinking
Yeah.
I have this idea of how things should be going in my life, how things should be progressing, and to really start to let go and be changed. And that's, one of the ways I'm doing that is talking actively as a coach who helps people with chronic symptoms, having chronic symptoms myself right now. Just being open about it. Shame thrives in darkness, right? It's like mold.
Wow. Wow.
So
It's
that's
very
why,
important.
yeah.
It's very important to, like, come clean, come clean. Um, there's just a little backup noise. Just make each of you guys make your volume a little bit
I
lower.
think I have my window here open. That's why.
Maybe that's it. Okay. Anyway, it's a little bit of like coming clean with in the most humble way that our personalities and who we are, that we're not here to blame, we're here to be responsible. Our
Yeah.
personalities creates our relationship with anxiety and stress, because anxiety and stress are not bad things. We need it to cross the street, to drive in a car, to drive on the highway. We need those. We need fear, we need anger, but how are we personally with our anger and our fear and our shame? So say that again about darkness. It's really important.
Uh, well, there is a
Please.
quote actually from that I got from Charlie Merrill, but he, got it from somebody else who I'm sure got it from somebody else. And
Repetitive
it's
intelligence.
yeah. The quote is shame is like mold. It thrives in darkness. Right? So when we,
Like,
Danny, you mentioned, yeah, shame is like mold. It thrives in darkness. And, Danny, you mentioned that somebody might come into your practice and have back pain or migraines or whatever, but there's a layer underneath. And we all have those layers underneath, and we often don't talk about them. We push them away. We say, no, everything is fine. And we have this tension because we believe that if we're to share this thing, if we're to be authentic, it's going to lead to this rupture in our community and with our loved ones. And I think it's so important to recognize that that happens because we were not met in some way when we were younger, or we inherited some way of being that is no longer serving us. It's keeping us trapped. And I think so many times when we actually share ourselves and share our authenticity, it's an opportunity not just to heal, but also to bring us closer to others. And so I think it's so powerful. It's such a powerful part of this work that hurts happen in the relational field, and healing also happens in the relational field.
well, yeah, and I think in the most humble way, our ego gets in the way. I mean, we are embarrassed, we are successful, smart, very sensitive, successful, smart individuals. I call this sensitive, like your sensitivity is your power. And we're people that have succeeded in many things. Lots of TMSers have succeeded in many things, and then boom, in the face. And Doc Hanscom talks about this. He's got a new book coming out about repetitive, intrusive thoughts. And a big thing is about the ego. Like he talks about like just dissolve it, like it's getting in your way because we can't even deal with the fact that we can't, it's a bigger topic, but it's very powerful when you talk about authenticity and sort of facing the monster under the bed, which is a toy monster. It just, and the love of self, the unconditional love, the radical love of self, it's hard for us. And I say to you, gentlemen, and to the listeners, are we curious? I'm not going to use the word why. Rose would teach me. Are you curious? Are we curious? Are we curious that it's so hard to love ourselves? We can love another, but are you curious? And these people, and what I always recognize is these are beautiful people. They look good. They love their dog. They take care of their dog. And I'm like, oh, wait a minute. You're taking care of your dog more. Wait a second. You're giving your dog more attention than you. I mean, like I call them on, like they're like, yeah, and I'm like,
they're using it as a way to run from themselves, right? Because now they care about someone else, so they don't have to care about themselves.
well, why are we running from ourselves?
That's a good question, right?
Can we be curious about that? Lauren, welcome. Lauren, can you answer this question? Like, are you curious why we run? I don't like the word why. Curious how we run from ourselves and then we trip and then we're back to the same place. We're not really going anywhere. It's like the Matrix, So let's chat about that. It's important for our listeners in the most humble way. We've all gone through it. We're all here coming clean. Like this is like an AA meeting, We're all here coming clean. Like, what do you think?
It's a great
Alex?
question.
Yeah.
So yeah, I want to say that, and we can tie Alec's story to this question. First of all, Alec, it sounds like you have made a big change with yourself, and not only with pain. It seems like it helped you grow as a person. So that's amazing, and this is great for you, and now you can help other people. You mentioned a few good nuggets there in your story. One of them was becoming aware of what's going on, and I can tie it to your question, Tovah. Basically, you were running away from yourself or your life, and you kind of understood it, through the cycling, and then you faced it and you became aware of the situation. So awareness was a big part of it. Another phrase you threw in there was let go. Right? You understood that you have to let go of all that in order to be able to move forward. So that was great concept. So yeah, I just wanted to point it out. And I think we as humans we tend to sometimes belittle ourselves, make ourselves less important than our environment, or it could be from the way we were raised or our belief system, what we believed about ourselves, and then we just live our lives in a way that we kind of avoiding ourselves and running away from whatever, if something happened in our history or not, and just trying to get involved in things around us so we don't have to face it. But as we mentioned before, your brain isn't stupid. If it knows that something is truly bothering you and needs to be changed, it will gain your attention one way or another. So yeah, I mean that's part of being human. I think the biggest challenge in this world of mind body and any health practitioner is that behavioral change is probably the most challenging thing you can do, because even if you understand what's going on, now to actually change the way that you've been behaving for such a long time, that's really the biggest challenge. And sometimes it's so hard that people don't want to deal with it, right? So that's when they're looking for something else to occupy them, or something else to fix them, or stuff like that.
Yeah. Good point. Great point. What do you think, Alec, about that?
Well, it brings up the Bruce Lee quote. You mentioned Bruce Lee earlier, Danny, and I'm going to butcher this probably, but he says,
Go for it.
knowing is not enough. We must apply. We must
Well,
apply it.
that's
Something
And guess
along those
what?
lines.
definitely,
And guess what?
yeah, and that's something huge. And you hear it not only from him, but a lot of it's a known quote. Yeah, knowing doesn't help you if you don't apply it, right? You can read all the books in the world, you can talk to all the people in the world, you can listen to us, but if you don't go and use at least one thing from that you listen to today and try to imply it towards yourself, then it's not worth it. It will do the opposite, because you're just gaining more and more stuff in your head that you're not using. You're gonna feel heavier.
Right.
So yeah, you
Absolutely.
wanna use what you learn.
And it is a clear indication that we are coming out of our comfort zone, because it's almost easier to lean into the medical model. I got a label, let's fix it. And we're just not capable. This is another quote from Hanscom's book. We're not set up, our body and brain are not set up for mental, he phrases it like we don't have we don't have the ability to deal with mental capacity as we can physical. We can deal with physical pain. It's there, it's real, let's get rid of it. But the mental capacity, the emotional, we don't have the fight or flight mechanism is not for that. It's for protecting you from danger. So the whole mental part that we're all learning, and we're all learning it together. And that's why I go back to the humility and the authenticity. And so I want to answer the question. 1 second. I want to answer these questions. Welcome. I don't know some of you guys, but above, I'm a little bit something with my thingy. So I'm going to go. Oh, yeah.
I'll take the one from Jennifer.
Jennifer, yeah, please.
So Jennifer's question, it's a great one.
Yeah.
So hers is pain. So pain is not a result of structural spinal findings. That's the question. The answer is about 90% of the time that is true. There was a study done that was published last year, I believe, in the medical journal Nature. And they wanted to answer the question, how often does somebody who has non-specific low back pain, so just general low back pain, how often do they have a structural abnormality that shows up on an MRI, an X-ray, an evaluation that is actually causing the pain that they're experiencing? So this was done in Lake Charles, Louisiana. They had about 228 people in this study. 98% of people had a structural finding on their evaluation. So a herniated disc, a bulging disc, degenerative disc disease, facet joint issues, et cetera, et cetera, et cetera, et cetera. In only 5% of cases were those structural issues solely responsible for their pain. In about 6% of the cases, there was a mix between structural and brain. In a whopping 88, 89% of people had low back pain that had nothing to do with the structural findings. That's, I think, such a powerful thing for people to realize, that what they're seeing on their MRI might not be the cause of their pain, as is the case with me, as is the case with clients, patients that we see.
We are meeting people who had structural issues, like the woman in Love Heals. You got to see that movie if you haven't seen it, to the listeners. She had 2 failed spinal surgeries, leaking spinal fluid, and she still was able to have a very evolved relationship with the pain and live with pain in a very evolved way, reducing the pain. So even if it's structural, and Gordon says this, Scribner says this, Hanscom says it on the book, you could have structural problems and still have a different relationship with your brain and reduce the pain, dial down the pain, lessen the pain, have a different response to the pain. So that's what we're going for also. Absolutely. We're not stopping at the 5% that you're talking about.
Exactly. I see Jennifer's comment in the chat there of, can you drop the name of that study again? I don't know how to drop a link. I don't know,
you can tell me, and I'll.
I could put it in the host chat, and then if you want to drop that in.
I don't know if you can. Oh, do that. Yeah. I've never done that before.
If not,
I also know Jennifer, and I'll connect her to you to
okay.
get that study.
Yeah. So Jennifer, the name just to share is application of a clinical approach to diagnosing primary pain in the Journal of Pain.
Great. So the message above Peter, I can't see. Who's the message?
If I can just add something for
please
for Jennifer. Jennifer, in the chiropractic world, it's very common to rely on X-rays because it's a good way to pull people into your clinic and keep them in there. Because usually you'll find always something on the X-ray. And early in my career, I worked in such a clinic. We used to see like 80 to 100 patients a day. Yeah, it's one of those factory. Yeah, and I hated it. That's why today I'm doing totally see. Today I'll sit with. I'll probably see 6 people in a day, and that's a full day for me. So yeah, back in that clinic, they used to X-ray everyone when they came in for the first time, and there was me and 2 other doctors, and the 2 other doctors we all were trained on finding something on X-ray and then explaining it to the person and why is it causing their discomfort or pain and why they should do this and this treatment. And I had a different approach. First of all, I never wanted really to use X-rays unless there's really a need for it, like in severe injury or nothing else is helping. We need to look deeper. I really don't like taking any imaging if unnecessary. But the way I would explain X-rays to people is, what? We can see some structural changes here, but relying on the story that you're telling me and how you're presenting, I really don't think that's the cause for your pain, and I really think we can treat it from a different aspect. And that would, really resonate, with the people. They feel like, oh wow, there's something else I can do.
Yeah.
The other doctors, they used to go the different route. Wow, look at this X-ray. Look what you have here. You see this? Wow, yeah, this is gonna take a long time to heal, and we have to really work hard on it. And we'll have to throw a lot of treatments and stuff like that. And then people would feel like, oh, well, good. I know what's going on. But now, how am I going to deal with it? And their stress would just go up the ceiling, right? Because now there's really something wrong, and so I think again, there's no really need for X-rays or MRIs or anything unless you had a severe injury or something like that. The way that whoever is going through those imaging with you and communicates what's on them with you is very, very important, because
good point.
It will define how you respond to it. And that will actually make or break your healing. Mm-hmm. So take everything with a grain of salt.
Very good point. Alec, can you read the statement above Peter's, because not seeing it yet. Above Peter, there was
Lauren Kalela Poloon. Sorry, Lauren, if I'm butchering your name. She says, always wanting to help or fix other people, yet my own worst critic, perfectionist. I have been dealing with vestibular migraine for about 5 years in September. In September the last year, I've learned more about Sarno and believe this more than anything else.
Wow, great. I mean, you're in the right community, and there's just so much to learn. But most important, the 3 of us here on the board of directors agree you can learn it all, but if you're not applying it and implementing it when you most need it, like not on the yoga mat, you got to apply it when you're feeling a lot of pain or sensations, or when you're really angst. And this is opportunities. Like the times when you're triggered are opportunities. You're not being punished, you're being protected. And so these are big opportunities. And so all the power to your process and applying and implementing. And we're all here to support you. And there's tons of stuff on Facebook and all over the world. And I'm not even talking about Mr. AI or Mrs. AI or Dr. AI. It's like, well, people are calling me and saying, I just AI'd why I'm in pain. I'm like, you don't need me if you have AI. It's like fascinating. So we're not going to have a discussion about that. But anyway, listen, because they're saying AI saying what we're saying. They learned it from us.
It's, funny you mentioned that. I got a client who had been to, I think, 16 doctors, some of the best doctors in the US had surgeries, and he was at the end of his rope and he typed in to ChatGPT. He's like, what else might this be? He's like, Sarno is your only hope. And that's essentially, and then he found me. So thank you, ChatGPT.
Wonderful. So now, I don't see Peter's. I'd like to. Nice to meet you.
He has a great question. I'd love to talk about that.
Yeah.
Or I can read it, and then Danny, if you want to take a stab at it, or Tovah. Peter says, I can identify psychological/historic causes of TMS. I want to learn how to feel and harvest repressed emotions.
I want you to answer that, please.
Well, first of all, the first step was already taken, and you are aware of the emotions. I think the second thing is it's not something that you really how should I put it, have to really hard try to learn or focus on. The first thing you want to do is welcome in whatever emotions that you're realizing that you have buried in, whatever the story is. Just let it come in. Don't push it away. Don't try to make any judge it in any way. Just let it come. Just explore the story. Let it be there. Because what you want to do is just make yourself feel comfortable with it, so it doesn't ignite that response of pain or anything else.
Beautiful.
And once once you get used to having it around, that's when you can retrain yourself in how you respond to it. And there are different ways, and I'm sure Alec could add more to it.
Good answer, Danny.
Yeah. So I'll be a little bit of a Sarno contrarian here, and I'm curious, Peter, if in the same way that we can get ideas about what healing our body needs to look like, we can get ideas about what healing neuroplastic symptoms needs to look like. And I come across people who say, I just need to get to all of my repressed, trapped emotions in order to heal. And in certain cases, yeah, that's important. But there are so many different ways to heal. There's so many different ways to get the results that you want. For example, I spoke with a woman who had been doing so much journaling, consistent emotional journaling for months and months and months, was digging up a lot of emotions, but her symptoms weren't getting better. And it wasn't until this client started to back off and treat herself in reintroduce fun into her life and actually back off from some of the emotional journaling that she started to get better. So we can talk about, there are different meditations and practices, EAET, emotional awareness and expression therapy, really power to access repressed emotions. And I think the biggest thing is that the biggest signpost that you have for these is to go where the fear is. If there's a conversation that you're afraid to have, if there's something that you're afraid to confront, that's probably where your time will be well spent. In the emotional awareness and expression therapy training with Mark Lumley and Howard Schubiner, they say it's all about going back to challenging experiences, not to relive them, but to express the emotions that weren't able to be expressed at the time.
Yeah.
And what they say is if there isn't a little bit of anxiety and discomfort and fear when you think about going back to that experience, it's probably not the right one. There needs to be a little bit of that in order for it to matter.
And the play is a very big thing. It's a very, very big thing. We're really serious people here. We really got to lighten up a bit. So anyway, I'm excited to answer Camille's question. Dr. Furlan, I think Arlene Furlan, anyway, I don't know her, says the brain synapses can never really be 100% fixed, and therefore symptoms will never be fully gone. And I 100% disagree. So I will say again what I've learned. I didn't learn this in chiropractic school. I'm 40 years outside of chiropractic school, and there's so many things I did learn there, so many things I didn't. I learned in the field that we have a pathway that's protecting us, and that will never go away. We build a stronger pathway, like neurons that fire together, wire together. We build a stronger pathway, better habits, healthier habits, safety and calm, a habit of safety and calm. We build that pathway and it becomes the default. So the pathway never goes away, that learned pain. We just built a stronger one. That was a little interesting to me when I learned that. So that's what I think she might be saying. And as far as I'm concerned, the brain is malleable and the synapses. So I think this is just jargon and logistics. But I'm not here to argue with anybody. I'm a peace, make love, not war kind of person. So I'm just here to say that maybe she feels that way. I wouldn't let it affect your healing, honey, at all. That's my opinion.
Agreed.
Yep, 100%. I've seen too many cases of people who fully resolve symptoms to believe it's not possible.
Yeah. I'm going to answer a big question. That's one, but Marita, you mentioned TMS therapists. Yeah, there's a number of directories. I have a resource page. First of all, the three of us are here. We're all TMS therapists. I do virtual. Alec does virtual. Danny is in Colorado and like an amazing mind-body chiropractor. So, but if you can contact me, I like to find someone local for you, or if you want someone virtual. A lot of us do discovery calls. There's some great people. I always say not everybody's for you. You have to feel safe with this person. And sometimes it's a personality. So take a few discovery calls, meet a few people, sit back, decide. Because, they say when the student is ready, the teacher comes. And they say when the student is very ready, they don't even need a teacher. And that's kind of like where I think we go here. So really, there's a lot of information on that. I can help you. You can just message me after the broadcast. And in the morning, I will give you those directories and information. I'm going to answer this question. Shannon, I've had tension in my neck and shoulder on one side for years. Now I've got tremors, weakness in my hand, and pins and needles, cramps when I move my shoulder forward. I had an MRI. The neck was okay. Good. And was okay. Degenerative and foraminal stenosis. Alec, that means the hole where the nerve comes out gets encroached with I guess build up a bone, but they didn't think it caused symptoms. Also, touch feels less on that side to the other, which has freaked me out. Okay, and I wasn't sure if the brain could cause. Wait a second. Could cause a loss of sensation. As a pain coach said, that concerned them. Okay. But I've been to physios and they didn't say much about the trapped nerves. Thanks for your info. I use that side for work every day. And fear, repetitive strain injury, or getting worse. I've been doing TMS approach the whole time, but I think fear is in the lead still. How do we want to support Shannon, guys?
So Shannon, I think your question is actually a very common thing that at least I see in my experience. It's going to be difficult to give you a good answer here because we don't have the full story. So it's not going to be fair towards you or the other listeners to throw an answer. But generally speaking, what I would say, Yes, the brain and mind can cause very interesting symptoms in our bodies, and it ties back into whatever we teach ourselves and what we believe, and that sensation of fear. If we are fearful of something physical, then all the symptoms will just go on fire, and you'll start feeling numbness, weakness, tingling. So definitely the mind plays a big role in it. Of course, there's always a holistic approach of what else are you doing in terms of movement, sleep, nutrition, all that stuff plays a role. But I think for in your case, what you want to do is tell yourself that you did all the physical exams. You always got the same answer from what I can read here, that there's nothing really, structurally wrong in causing your symptoms. While it's very hard to believe it because you are dealing with those physical stuff. You are still aware that your mind is a major actor here. So just go with it. Stop looking for other solutions, and commit 100% to that path. If you feel like that's the path that you should be on, then just commit to it. Don't let all the background noise distract you. Fear will always be there, because when we don't know what the outcome is, we're unsure, then we're fearful. And that's okay. That's very, very normal. So you're allowed to be afraid, but just don't let it take over. It's part of the process. And again, just commit yourself to the I think you said that you're doing the TMS approach, so not sure what
Yeah.
exactly you are doing. Um, but yeah, just immerse yourself in it. Don't do it as something you're trying, or as another modality. Really, give yourself that chance to explore this type of way, and I'm sure it's going
Beautiful.
to benefit you.
Beautiful. Alec, you want to say something to Shannon?
Yeah. So to Shannon and to people who are essentially Shannon's question is, do I have TMS? And it's such a common thing, right? We see this every day. And from my training, what I've learned is you need to be confident about two things. One, ruling out structural issues, which it sounds like the changes that you've described. I'm not a doctor, but I'm good thing we have two doctors on this call, and it sounds like the changes that are observed just based in this can be very normal changes that don't necessarily lead to symptoms. The second piece is to rule in neuroplastic symptoms. And to do that, we use often is used the FIT criteria, which stands for functional, inconsistent, and triggered. And this is something we don't have to go into it detail here, but if
Dr.
you
Howard
Google,
Schrubener, I can send it to you, a picture of it. So just text me tomorrow because it's from Dr. Schrubener's book, Unlearn Your Pain.
yep.
Yeah.
And that's what the study that I mentioned earlier about the 98% of people with back pain and only 10% was it actually something that was structural. The FIT criteria were used in that
Wow.
assessment, so it's scientifically validated. And I saw Howard speaking at the SERPA conference. I was on the live stream, and he was talking about how they're replicating that study with not just back pain but other areas
Yeah.
as well, which I think is so
Yeah.
exciting. But
Amazing. Amazing.
yeah,
Amazing. Also, just we're going to have to wind up soon, but pain is an emotion, and I learned this from a scientist. And then I kept, and it was on a curable podcast, and then when you want to you want to read Lisa Barrett Feldman talking about
oh yeah,
feelings and pain and your emotions, you just start to understand that chronic pain, like what you're having. I mean, if you told me you had an acute pain in your neck, an acute thing happened and you hurt yourself or took a fall or had a whiplash, I'd be like, okay, let's treat this with a neck collar. But this is not what you're saying. I'm talking about chronic neck pain. And And so I'm not comparing you to anyone else. This is your journey, honey. But the fear is way worse than the pain. And you know that. You're bumping up to that and you're understanding that. And so how do you want to understand your relationship with fear? How do you want to understand that the fear is what's causing the constant symptoms, what's creating the inflammation? I mean, anxious thoughts create inflammatory reactions. So we're so, once we're aware of this, we get to see how this threat safety physiology, I like to call it, works in our body and our brain, and how our relationship with our fear. Again, we can feel fear and not have physical pain. We can just feel fear. I mean, I'm living in a country where there's war, and there's threat and war, but I'm not in physical pain. I'm stressed. I'm anxious. I'm sad. I'm lonely. Angry again. I'm fearful. I'm also joyful and happy about, other things. And I'm hanging out with my feelings. I have no physical pain. I'm hanging out my feelings. I might have some little IBS. My hair's gotten kind of more white. Things have been happening this last year, but I'm not feeling physical pain because I'm kind of having this relationship with my feelings. And I think that's what we were talking about with the emotions. We're just going to have to come to terms that we're emotional beings, and we have to have a healthy relationship with our emotions and our thoughts. Big thing. Our thoughts, they're not true. They don't serve us. They're repetitive. They're negative, but they're in our unconscious mind. And we can actually have a relationship with them and say, okay, thought, you know what? I'm going to put you to the Byron Katie test. You're not true. Where would I be without you? I'd be happier. And I could turn you around. And what is a thought? I call it pixie dust. It's like the ticker tape. So don't let your thoughts rule you, because you are totally in control. Yes, and you can change them. You talk to Joe Dispenza, you can change them. Guess what? How? By accepting, by awareness. This is so powerful. This is beyond the matrix. This is matrix time 1,000. You can change your thoughts by simply letting go, by letting it be. And this is what I learned with the pain processing work. You can put a little lens of safety and look at those thoughts and look at that pain and be, you're not dangerous. There's no fire. I can look at you as something uncomfortable. It's uncomfortable, but I'm not in danger. This is powerful, powerful work. And you can learn to do that PRT at any time and have this relationship with your pain. I get really excited about this stuff.
I think
Well said.
I think if I can just, yeah, it was great. And if I can just add one more step here to Shannon and everyone else. I think a lot of the times we try to look for a cure or a solution to resolve our pain that's been there for years. And that's just a very big goal, right? And that will create a lot of fear and uncertainty. I think one thing we all should focus on when we're going through a similar journey is ask ourselves, can I make another step towards healing? And just focus on that step. Don't think about, the end goal. Don't look, too much where you started off. Just focus on where you're at now and what's the next step you should do. And Shannon, it seemed like you know what you should do. So just focus on that next step and do it and break it down. If you need a smaller step, take a smaller step, whatever feels comfortable, but just focus on it. And then slowly, you'll see you'll be moving forward. And that will help, heal, in a much, much better way.
Beautiful way to round up the hour and a half. I'm so excited that you guys could hang out with me. Alec, do you want to leave a few words of inspiration as Dr. Danny did, and we'll say Lala Tov.
Yeah, I'll keep it short and sweet. You are not broken. The only thing you need to fix is your belief that you need to be fixed.
Wow. So good. And then we have to apply that
We
and
have to apply
implement
it.
it.
Yeah.
And I
And
always
yeah,
say,
it's
tattoo it on your arm if you have to. Red lipstick on your mirror, whatever you need.
I think, everyone should understand that what brought you to that situation of being in chronic, symptoms or pain is that you really unknowingly, you trained yourself into it. You trained your body and mind into staying in that. So when you understand this, obviously you can train yourself to do the opposite.
That's it.
So I just want people to understand it.
Beautiful.
You can always
Beautiful.
retrain yourself in a different way.
Beautiful. 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 So real quick, this is going to be uploaded tomorrow to TMS Roundtable YouTube channel. And you can see some amazing things. You can see Dr. Danny, we met a few months ago. Alec is on there at least once or twice talking some magic, and lots of other wonderful people. Dr. Danny's information will be in the description. Alec Kassin's information will be in the description. You can reach them on Facebook, Instagram, LinkedIn. I'm around. Guys, you know where I'm at. And if you guys need any help, we're here to support you and to help you be the doctor. Yeah, we're terrible businessmen. We want you to be the therapist. Anyway.
Yeah.
So,
Yeah.
good afternoon to you guys. Thank you for totally blessing my virtual studio. I am just one blessed woman, and I'm such a wonderful, wonderful broadcast. There was so much powerful words of wisdom. Thank you so very much. Good night and God bless to the listeners. We will meet again.
Thank you,
Hi,
Tovah.
everyone.
Thank you, Alec. It was great
Okay.
spending time with you all.
Okay, it was great.
Likewise.
Good
Thanks,
night.
Tovah. Thanks,
Bye-bye.
Danny.
Good afternoon.
Thanks, everyone.
Okay, wait, we're going to go off.